And as we get started, as I said, we will be recording this meeting. Welcome, everybody. I do want to let you know that there will be time for question and answers at the end of the presentation. Um, Feel free to ask any questions into the chat. Our members will be taking note of all questions that come through.
Okay. But thanks to Keener for teeing this up, and good morning, everyone. My name is Tyron Nixon, and I serve as the Reentry Transformation Implementation Manager here at the Healthcare Authority. Welcome to today's learning webinar focused on Healthcare Authority's recently released Milestone 3, the Correctional Facility Readiness Assessment. Now, the readiness assessment is a critical step in the process for implementing pre-release services. All participating facilities must submit a readiness assessment to Healthcare Authority and have it approved before going live with pre-release services in their selected implementation cohort. Today, we will provide an orientation to the readiness assessment structure, discuss the submission process and scoring rubric for the readiness assessment, and review the document at a high level. And we will then open up the floor for questions and discussion. But before there, let's provide some background on the Reentry Initiative. Starting in July 2025, participating carceral facilities in Washington State will begin implementing the Medicaid Transformation Project Reentry Demonstration Initiative, a new Apple Health initiative. So the initiative will help Washington address the unique healthcare needs of justice-involved individuals, improve health outcome, support clients in health stabilization and recovery during their transition to the community, deliver care more effectively or efficiently, and advance health care or health equity across the state. Now, under the initiative, incarcerated individuals or clients who are Apple Health eligible will receive a set of services up to 90 days before their release. The Washington State Healthcare Authority is the lead agency for this work or in this work, collaborating with other state agencies, carceral facilities, accountable communities of health, managed care organizations, healthcare providers, community-based organizations, tribes, and other partners to support coordinated community reentry processes. About Milestone 3, the Readiness Assessment. The Readiness Assessment is the third milestone that carceral facilities must complete to participate in the Reentry Initiative. Milestone 3 helps Healthcare Authority determine whether a carceral facility is ready to go live with the pre-release services. Carceral facilities must have completed Milestone 1 and Milestone 2 before reaching this milestone. The readiness assessment builds on information carceral facilities provided in Milestone 2, the capacity building application, which requires facilities to provide preliminary information on meeting the initiative requirement and any technical assistance needed from the Healthcare Authority. As described in Milestone 2, the capacity building application, we recommend that carceral facilities work with a group of implementation partners, community members with lived experience, and subject matter experts to complete the readiness assessment. Our objective for today will be, again, to go through this readiness assessment, or walk through, if you will, and then we're going to end with some questions and answers, or Q&A. So in keeping with our practices for these webinars, please hold questions to the end, and then in the meanwhile, please feel free to put your questions into the chat, okay? And so the next voice you're going to hear is going to be Hillary, who's going to talk about the readiness assessment structure. Thank you, everyone, and over to you, Hillary.
Thank you, Tyron, for that lovely introduction. Good morning, everyone. I'm Dr. Hillary Yacoub, and I'm the Senior Coordinator for the Reentry Initiative, working with Tyron Nixon and others here at HCA, working in service to help you all implement the reentry program. So I recently started at HCA, but I wanted to share that I've previously worked at BHA, focusing on providing individuals necessary care, as well as focusing on community safety, and also being a certified community health worker, or CHW. I've previously worked in and around the populations that you're all currently working with, and understand your struggles implementing a program so large. With that, I understand that the readiness assessment that I believe Ed just dropped in the chat appear really overwhelming, and wanted to ensure you all that we're here for you every step of the way. The intent of the webinar, as Tyron shared, is to walk through each section of the form so that you're familiar with the form before you even begin filling it out. Even after the webinar, we're still here for you, so feel free to reach out to us with anything at any time with your questions, even if you're just filling out the form and have a question while doing that, please don't hesitate to reach out. So now to the readiness assessment. Takina, I'll give you a moment to pull up the background rubric. There are two documents that I'll walk you through here today. The first document, Takina already has pulled up, thank you so much, is the background and rubric, which I'll walk you through now. The second is the actual readiness assessment form, which is the form that you will fill out and turn into us. So let's talk about the background and rubric. In this document, on the first page, thank you, there's a short blurb about the program, something similar you've seen with the CBA in that background and background information form. And here, this document lays out also the rubric, and we can walk through that together. Thank you. So in order for a carceral facility to go live with the readiness assessment, well, actually, let me back up. So a carceral facility that submits a readiness assessment, you'll receive one of the following determination. The first one is the facility can be approved for go live. And this means that your facility would have received approval across all sections of the readiness assessment. This is critical factors and non-critical factors. And these facilities may go live on the proposed go live date. And I will walk through what a critical factor and non-critical factor is here shortly. The second determination is conditionally approved. For facilities that are conditionally approved, that means that your facility has planned processes for critical and non-critical factors, but those processes are not yet in place. And HCA will continue to track your carceral facility's progress towards the necessary components of the program until go live date. And facilities here that receive this determination may go live on the proposed start date, contingent on confirmation of your carceral facility's readiness by HCA. The third determination is pending approval, and facilities can receive this determination if one or more of the sections are still essentially pending approval, but there's still some, and there are also some sections that have approval. So an example here is if there are non-critical factors that are missing for RTCM or provider enrollment, HCA will share that some of these items are still pending, and HCA will provide technical assistance for the carceral facility on those items. And facilities can still go live on that proposed date, but they must resubmit required information to demonstrate readiness for those remaining factors on an agreed upon later date with HCA. The fourth determination that a facility can receive is not yet ready to go live. Your facility could receive this designation due to the responses being incomplete or not indicating readiness across all critical factors, and facilities deemed not yet ready will not be able to go live on the intended date. And of course, HCA will provide necessary technical assistance to support carceral facilities that have received this designation to ensure that we get you to the go ready for go live. And also on this document, you'll see that there are funding for Milestone 3 Readiness Assessment and that breakdown by the tiers. There's also information for technical assistance, pointing you to reach out to the reentry inbox as needed. And also there is a background, or there are some background information on the last page for the CAA 2023 for you all to reference as needed as you're filling out section 1.7 of the readiness assessment, which coincides with the CAA 2023. On the readiness assessment form itself, which is now, or which we will go to now. I know that the form talked about technical assistance reaching out to the reentry inbox. I did want to highlight that there are also ways for you to request technical assistance on the form itself. So let's talk through the readiness assessment form. First, let me walk you all through the structure. It's organized into sections that is supposed to collect, or I guess is designed to collect information about your facility's readiness to support the requirements of the initiative. And within each of the sections of the readiness assessments, there are 3 elements. The first, attestations. These are things that you're already familiar with, given that most of you here today are in cohort 2. So you've all, or at least mostly all of you, have completed a CBA. So these are things that you're all familiar with. The attestations, as you're familiar with, indicate the policies, procedures, and infrastructure in place to support the mandatory requirements for the initiative. And for each attestations, CFs must indicate one of the following. Either your CF currently meets the requirement, which, as the statement suggests, you currently have processes and capabilities in place to satisfy the requirement, or your carceral facility will meet the requirement by or after the go live date, which, again, as the name suggests, indicates that your carceral facility will meet the requirement by or after the go live date. And please do note that if your facility does select this option, your facility must include a date for when the facility will meet said requirement. That is something that we do look at closely. So please ensure that that is filled out if that is something that you check for any of your attestations. The second element of the readiness assessment is implementation narratives. And here, narrative response questions for carceral facilities are provided, and it allows for you to detail your implementation approach for the laid out requirement. So for facilities that indicate that they will meet the requirements by their go live date, in the narrative response, you do need to describe your plans for meeting the requirement by that date that you shared. And now I'll kind of loop back around and talk about the difference between critical factors and non-critical factors. So here you'll see with some of the narratives, there are some narratives that are going to be marked as critical factors, and those will be bolded. At the beginning of the question, it'll say critical factor. And the non-critical factors are essentially ones that don't have that designation. And within the implementation narratives, the ones that are marked as critical factors, those are the ones that the carceral facility needs to demonstrate readiness in order to be deemed ready to go live. So these are items that subject matter experts here at HCA have identified as showstoppers. And the third element that you will see throughout the sections of the readiness assessment form is document submissions. And here some sections of the readiness assessment have required or optional document submissions. For example, you'll need to submit an organizational chart, basically detailing your facility's staffing structures and also how your facility plans to support the initiative requirements via staff. So I'll now provide an overview of each of the sections in the readiness assessment. The first section we will cover, Takina's already pulled up for us. So, I think actually it's 1 page up if I'm not mistaken. Maybe 2 pages. I'm so sorry. Yay, thank you. Okay, awesome. So this first section focuses on ensuring there is no cost to clients who receive reentry services via Apple Health. This section is a little bit different than the section that you all attested to via the CBA in that it has an additional attestation that you have not seen before. We received feedback from our MCOs saying that this is something that we should include for you all so that you're kind of just aware of the requirement, and that's provided for you here on the form to be able to just be aware of. And in this section and in every subsection in the readiness assessment, there is also a box for you to fill out to share any technical assistance that you currently need in order to successfully go live as it relates to that specific subsection. So Takina, if you can scroll down just a little bit. This is what the technical assistance box looks like. It does look similar to the one that it is currently on the CBA, so kind of keeping with that structure for you all. And this is kind of what I was referring to in saying that, yes, on the background and rubric, it shares or it lays out that you can reach out to us for technical assistance via the reentry inbox, and also feel free to use this box here. And there will also be one additional place that I will share with you all for you all to list out any technical assistance needs. Moving on to section 2. This section addresses staffing, governance, and resources structure. And the focus here is to ensure that facilities have a structure in place to support all mandatory requirements. This section contains attestations and narrative responses with, oh, I did want to note that first section does not have any narrative responses, just those 2 attestations. This section has narrative responses and attestations with critical factors focused on staffing and governance structure, as well as processes for coordination with key partners such as MCOs, clinical partners, and then community and native hubs. And here, we ask for you to describe your internal staffing plans to ensure that all reentry initiative requirements are met, including your approach for oversight of partner organizations. And here there's a new attestation that you all haven't seen in the CBA, where we're asking carceral facilities to update HCA through the reentry inbox if there are any changes to your carceral facility's key contact as provided in milestone 1, letter of intent to participate. And I believe that's on the previous page. Takina, if you can scroll up just 1 page. Beautiful. Yeah, it's so the attestation number 4 in section 1.2. And then this section does include the third element that I kind of discussed with the breakdown of the structure. So here you are required to submit an organizational chart and governance structure for reentry services. We do ask that you do please provide these and label them in accordance to the directions provided. Takina, if you can scroll 1 page over. Thank you so much. 1 more page. I'm sorry. Okay, I lied. 1 more. Oh, okay. Maybe it is 1. I am so sorry. I can't find the instructions. Oh, there it is. Yeah. Okay. So yes, it is labeled. So after you see how like for question 1, it says critical factor, and then kind of please label the attachment 1.2 organizational chart, facility name, year, dot, month, that day. That's kind of what I was trying to draw your attention to, so that you're kind of aware of the labeling that we're requesting. And just as a heads up, the more details you provide here, the easier it is for our subject matter experts here at HCA to review your form. So the more, the better in terms of details provided here. And then section 1.3, which we will move to. Thank you, Takina, for your patience with me. I know this is a large form. We'll go down 1 more page. Beautiful. Thank you. So section 1.3 focuses on Apple Health eligibility, application support, and incarceration and release date notification processes. And in this section, facilities will be describing your processes. So you'll be describing your processes to screen for Apple Health eligibility and support enrollment, and how you will support enrollment in Apple Health for clients that are not already enrolled. whether it's through in-house staff or community-based navigators or assisters. So just let us know what processes you have in place to kind of meet those requirements. And in this section, facilities will also be asked to describe processes for sharing items like release dates with HCA and with post-release RTCM providers, and also providing Apple Health contact information upon release to promote a smooth reentry transition. And many facilities already share release dates with HCA, and HCA will be working with facilities that do not need to, or sorry, that do not currently have an established process. And now section 1.4. Awesome. Thank you, Takina. So section 1.4 focuses on Apple Health provider enrollment and billing for reentry service, healthcare providers, including pharmacies and facility staff, and participating providers outside of the facility. This section contains attestations that in-facility providers and pharmacies are enrolled in Apple Health and that the facility has adequate in-reach and in-house providers to ensure service deliveries, service delivery. There are additional attestations to ensure pharmacies are able to individually label and bill Apple Health, and to confirm that your facility is able to bill provider one and or MCOs for any services delivered by in-house providers. We also have narrative questions here. Takina, if you want to scroll to the next page. Thank you. We also have narrative questions here for this section that asks you to confirm whether you need the claims clearinghouse to bill, how your facility plans on billing, for you to confirm the status of provider enrollment for all your providers serving clients in your facilities, and also for your facility and also for your facilities and providers' current status in contracting, credentialing, and or MOU processes with each of the 5 managed care organizations. And in this section here, we're also asking you to describe how your facility plans to be reimbursed for medication administered or dispensed that are not billed by an enrolled pharmacy provider. So the next 2 sections, we are ready for, yeah, thank you. Section 1.5, one more page. Thank you. So the next 2 sections, you'll see are the biggest sections in the document, but please don't be overwhelmed. The first section we have is section 1.5, which focuses on operational processes for delivery of reentry targeted case management. And again, we understand that this section appears very vast, but we do want to share that the required responses vary based on who will be delivering RTCM at your facility. So who will deliver your RTCM is broken down into 2 groups. First, we have the in-house facility care managers. These are the care managers who are directly employed by and work within your facility, while in-reach, on the other hand, are community care managers who are based within the community, who either come into your facility who do come into your facility to provide care coordination and support. If you will be using both types of providers, then please do fill out both sections and share your processes for both types of providers. But again, I know this section looks fast, but most carceral facilities fill out portions of it depending on the provider type that they will be utilizing. So there is that section though labeled at the top. As you can see, it says in parentheses, all facilities must complete these attestations. So those are the ones that we do require all facilities to complete. And then Takina, if you can scroll please to the next page. Thank you so much. In this section here, starting at attestation number 6, you'll see that it's like a subsection that's has in parentheses complete if your facility will be using in-house RTCM. So again, these are providers that are employed by your facilities who provide services in the facilities. So narrative responses are also laid out very similarly where you will basically complete the narrative responses for the types of providers that you'll be using. So the types of questions we'll be asking are the processes for identifying clients for RTCM services and how you'll be documenting refusals as appropriate. Also, we're asking you to talk about your facility's infrastructure for service provisions. And we also have narratives for you to talk about how you're going to be ensuring all components of RTCM are delivered to clients, including reentry assessments, a warm handoff, and reentry care plan, as well as care coordination connections to community resources. Here, you'll also see questions that are, well, here it's optional for you to submit a care plan document as a supporting documentation. And I think that kind of sums up the types of questions that you'll see here. Takina, if you can scroll through the remaining attestations and see how, again, for the narrative questions, it has in parentheses complete if you'll be using in reach case managers, and then the previous section had the same for in-house. Feel free to continue scrolling. Awesome. And then here's the supporting documentation where we're asking for you to submit a required org chart if you're going to be using in-house case managers. And then also we have the optional care plan template here below as well. And then again, technical assistance requests, feel free to add in here anything relating to section 1.5 that you will need technical assistance with. So this is, now we'll move on to section 1.6, which is the second large section in the readiness assessment. And this section here addresses support for medications, support for substance use disorder medications, and support for providing medications upon release. So throughout this section, similar to the previous sections, we have critical factors that are flagged for narrative responses, and we have attestations as well. And the narratives and attestations are really focused on supporting medications, and we'll ask you to walk through your facility's process for providing medication through an on-site or off-site pharmacy, including mail order pharmacies. We also ask for you to provide a process for complying with prior authorization and utilization management requirements, your facility's process for safe storage and dispensing medication based on medical assessments. We're also asking you to share more about how you'll be collecting existing medical information on medications and collecting, and also, so collecting existing medications upon intake to name a few of the questions that we'll be discussing. Also, please note that attestations and narratives will also focus on SUD treatments, which requires the facility to lay out the processes for screening and providing timely continuation of SUD treatment medication. You'll also see that in this section, we've also included attestation and narrative responses asking you to describe how your facility will deliver a 30-day supply of medication upon release, including sending refill prescriptions to community pharmacies, not partners, excuse me. And we'll just scroll through this section. As you can see, there are a few attestations for you to attest to. And then 19 is when we start asking the narrative questions. Feel free to continue scrolling. Thank you. We have the support for SUD meds. Awesome. And then support for the 30-day supply, and then the technical assistance box. And now to the last section in section 1, which is section 1.7, And here, this section addresses services for clients eligible for services under the Federal Consolidated Appropriations Act, CAA of 2023. And as a reminder, there are two key sections of the CAA. We have section 5121, which applies to Apple Health and CHIP clients who are post-adjudication and ages 20 and under, as well as between the ages of 18 and 26 who aged out of the foster care, who age out of foster care on or after their 18th birthday. And here for section 5121, these individuals' facilities must provide clinical assessments and evaluations and RTCM services in the 90 days prior to release. For section 5122, which applies to Apple Health clients who are pre-adjudication, they meet the same requirement as section 5121. And also, facilities may provide appropriate and medically necessary benefits for the full Apple Health benefits package. And attestations and narrative questions in this section address carceral facilities' ability to provide these services, including scheduling and logistical support infrastructure. And yeah, now we've gone through all of section 1. There's a technical assistance request box again. Section 2 is super short, y'all. The intended purpose of it, Takina, if we can scroll back up. Thank you so much. The intended purpose here is to really have a section in the readiness assessment that allows for carceral facilities to submit requests for any technical assistance needs related to the program requirements that are not captured in section 1 or TA boxes that are in section 1. So if you did share something also in the specific section, like a TA request in section 1.3, for instance, you don't have to rewrite it here. No need to duplicate, but again, just like wanted to provide another space and place for you to share any technical assistance requests with us. So we have walked through the readiness assessment form. I'll talk through the submission details. We are at the home stretch. Takina, the last page, please. Wonderful. Thank you so much. So once you've completed sections 1 and 2 of the form, if needed, in terms of section 2 of the form, if needed, the readiness assessment has a 1-page section here, as you can see, with a program certification, a go live date request, and a space for an authorized representative to sign and attest that all submitted information is complete and accurate. So once a facility completes your readiness assessment, pardon me, it should be submitted to HCA via email to the HCA Reentry inbox. And carceral facilities should aim to submit their readiness assessments to HCA 4 months prior to their intended go live. So for facilities planning on going live January 1st, which 2026, which I think a lot of you here are as a part of Cohort 2, readiness assessments are due by Monday, September 1st. We'll provide further guidance on submission deadlines and details. Well, the details will probably be the same, but deadlines for future cohorts at a future date. Please note that with milestone 3 or the readiness assessment here, facilities are also required to submit a final IT infrastructure budget to HCA with their readiness assessment. I know that a lot of you already had submitted one with your CBA, so no need to resubmit unless there were changes to that budget, but we are not requesting a resubmission here, just sharing that this is required for this specific milestone to be complete. And once your facility submits your readiness assessment, HCA will review the submission and in order to make a readiness determination. And we will reach out with follow-up questions, most likely while reviewing your readiness assessment to clarify or gather additional information as needed. Please note that to ensure a quick turnaround with the results of the determination for your readiness assessments, we will ask carceral facilities to respond within 2 business days to the follow-up questions our subject matter experts ask. So that'll come from our implementation team, and they'll be reaching out to your contact and then provide you with when we would like the answers to those questions. And then hopefully shortly after that, a determination will be provided to you all. So I know I was talking for quite a long time, and I know that I might have missed some stuff in the chat, but we are ready for some Q&A. Oh, is September 1st a Labor Day? Thank you so much for flagging that. We will talk that through and probably just move it to the following day on that Tuesday. Thank you
Yeah,
so much,
Hillary.
James.
Yeah, this is Tyron. Yeah, the holiday falls on the 1st, so yeah, we can make it the 2nd. Thank you.
So that's good. Awesome. So now we'll have some Q&A with you all. Are there any questions about the readiness assessment, what we walked through? We also have a lot of subject matter experts here on the line from the for the various sections. So feel free to ask away. I'll give folks a few more moments in case they're writing in the chat. But if no one has any questions, I don't want to keep folks here longer than necessary. Any of our subject matter experts who are on the line want to add anything to what was shared about the various sections? Did I miss anything or misspeak about anything?
Yeah, not seeing anything in the chat yet, Hillary. Yeah, open to giving folks back some time in their day.
Sounds good. Awesome. Thank you, Amy. All right, with that, we'll give everyone 20 minutes back. Thank you all for being here today. Thank you for our HCA team for also being here today. I hope you all have a fantastic rest of your Wednesday.
Yeah, thanks everyone.